So up next, we're joined by a panel of our patients to speak about their experiences living with LVAD. The patient panel will be moderated by heart failure cardiologist, Dr. Reema Hasan, and VAD coordinator nurse, Linda Boland.
Hi, thanks everybody. My name is Linda Boland, one of the VAD coordinators here at Michigan Medicine. I'm here along with Dr. Hasan. Hope everyone had a good lunch. I am delighted to have two patients, hoping for three. Mr. Nick is not here yet, but we do have Chris Vandercook and LaVisha McDonald here to join our patient panels. They're going to answer some questions and hopefully have lots of questions to answer from our gallery of participants here. So thank you both for being here.
Thank you for having me.
The first question I'm going to have you answer is to share a little bit about your journey with heart failure from the diagnosis all the way to where you are today joining us here. Yep, LaVisha, I'll have you go first.
Yes. After I had 5 children, and after I had my 6th child 13 years ago, right after I had him, I went into congestive heart failure. And they didn't know why I had went into congestive heart failure, but I went into congestive heart failure, and my doctor didn't know what was, going on. So he referred me to the University of Michigan for a checkup with them.
And then when did they let you know that about the LVAD, about that being a possible therapy for you?
Oh, maybe about 5 days after I got there, they was introducing me to the LVAD. Yes, they were in it. I was very sick, so I listening to them, but I just wasn't paying really good attention. But it was like, if that's what's gonna make me live, go ahead and do it. So I got an understanding of it, but I didn't get a good understanding because of the illness, how ill I was.
Yeah.
Yes.
Chris, how about you? Chris, you're muted.
Okay, can you hear me now?
Yep.
Okay, back in February 2013, I went in for a stress test. I was immediately sent to the hospital to have a cardiac cath done, and I had an aortic aneurysm, which in the process of the repair or in the recovery afterwards, I had dissected, and therefore at that point in time, I don't know a lot because that's when my journey started, and it come down to a life-saving surgery that had to be done. So I didn't have a lot to say. My wife, it was either that or it was a do or die situation. And that's how I began my journey. And it's been fantastic ever since. It's been, I've carried on at the University of Michigan. I'm on the heart transplant list. Now for going on 9 years because I have antibodies, but right now my life has adjusted because of the LVAD, and I am so glad to be around again and to be normal.
So Chris, how long have you had a VAD for?
I've had the VAD for, well, it'll be 8 years. I think it was the first part of, well, I think at the university it started like September of 2013.
Okay. And were you listed for transplant at that time, or did that come later?
Within the same, we're very close by then, yes.
Okay. Okay. And how about you, LaVisha? LaVisha, how long have you had your VAD for? Oh, you're muted too. You can unmute it.
Yes, 13 and a half years.
Wow.
I like to put that half in there.
Yeah. Every day counts. That's amazing.
Yes,
And do you guys mind sharing? I hope you're comfortable with this, how old you are.
I'm 49.
Okay.
And I got the LVAD when I was 35.
Okay.
I'm just old. No, I am
Never too old.
yeah, I'm currently 63, but this my journey began when I was 54.
Okay. And LaVisha, do you remember when they approached you and told you you needed a VAD? Do you remember what you were thinking or how you decided to proceed with a VAD?
Well, no, I don't. But all I know is that it was a life or death situation. And all I know is that I had 5 children at home, and whatever they needed to do, I needed to get better and get home to them. So I remember like, yes, come on, I'll do it. Yes.
Okay. And Chris, it sounds like you were pretty sick too at the time of when you got your VAD.
Yes.
Okay. But were you involved in the decision making, or were you too sick for that?
I wasn't because
Yeah.
it was more of an emergent situation. One thing led to another. I know my wife said it was sort of a blur because things were happening so fast. And but I do know, I even asked her this morning, and she says she was approached by the doctors and said, we have to do this. If we don't, this is going to be the outcome, which was negative. And we chose this, obviously my wife did, and I'm just thankful for all those events.
Okay.
So you both kind of answered a little bit about our next question, what the decision process was like for both of you, and both of you weren't really too involved in your decision because of how sick you are. Here at Michigan Medicine, we do have patients who volunteer to talk with other LVAD patients when the decision isn't an urgent one, so that patients that don't have to have it emergently can kind of make more informed decisions. So we do have that available for some of our waiting for people. So I wanted to ask about the next question here about your support systems.
Yes, I have a very large family. I have 6 sisters and brothers, and they were so supportive. They helped make the decision, as far as me getting the LVAD. They took care of my children while I was in the hospital, and they were there to see me. They will push me. Even when I decide, I'm like, no, I didn't sign up for this. I don't know what's going on. After I was getting better, I was like, I have to live like this? I didn't sign up for this. But they talked to me, and they really, really, really supported me through this journey. Yes, they did.
How about you?
Pretty much the same thing. My sisters and I have some very close cousins, and my wife were very supportive. They basically held it together, thank God, and they went on this journey with me. I know it was rough on them, but we're all very grateful and happy that we've come this far, and that you guys have done such a wonderful job of keeping us around.
LaVisha,
I think the answer is yes. I did have a very, very big support system. They were by my side the whole time. In fact, if it wasn't for them, when I was coming in and out of the coma state and such, I would have been totally lost. So
I think that's really important because, we often have to really sort of search for support, and you both are very lucky that you had that support system. So you can imagine how hard it is when people don't have the support they need to be able to do this. I know getting a VAD it's definitely life-changing in every aspect. But I don't know if both of you have, you know, probably the biggest thing that changed your life after getting a VAD, and what you would tell patients about that?
Well,
So hard,
for me,
'cause-
yeah, well, for me, I thought it all was big in the beginning. In the beginning, it was like,
Yes.
oh, I can't do this, I can't do that, I can't do this, I can't do that. But as I got to adapt to it, my life just changed perfectly with it. It was just perfectly changed with it. And it's like, it's just no limit. I guess when you have it so long, you make your life just involved with it. My children are so involved. They will hear the ambulance sirens go off around our town because it's so small. And the first thing they would do, Mom, you all right? And now, in the beginning, now they don't even call and check anymore because they know that I am good, you know. And so I just adapted to it, and it was you know, kind of scary in the beginning, but as the years went by, I adapted to it. I just adapted to it when the years, all the different things I could and couldn't do, during the years, I just started to adapt to them.
Okay.
Yes.
Chris, anything that really stands out for you in terms of life-changing?
Everything that she said is pretty much the same with me.
Okay.
It's an adaptation. It's acceptance of the new you, because you have to accept the fact that you are different than what you used to be. If from my standpoint, because I wasn't living with the struggles that some people have taken with advanced heart disease. Mine was an emergency situation and staying alive situation, so I didn't have as bad of the struggles. And so, but once I had the VAD, once I accepted, okay, this is the new me, I'm gonna go on. And as life goes on and progresses, the adaptation, like you just said, is just great. Now it's part of me. It's like, I don't know what it would be like to be without it.
Right. And then Nick, I know that you've joined also. We're so glad you're here. If you don't mind just sharing how old you are and where you are in your VAD journey, how you got there so far.
Well, I was 45 years old when I started having the symptoms of heart failure. And I mean, it's a long journey. I mean, between Flint and then I went to University of Michigan. They fixed me good. I'm still here. They fixed me good.
Good.
I mean, at the beginning, when Dr. Colin mentioned it to me, it didn't get to my head that it's going to be open heart surgery and they're going to put a pump in my heart and wire coming out of my stomach. I mean, it was something big, but either I live or I die. But it wasn't easy at the beginning. A couple of months after I started feeling good, I got my energy back. It's like a miracle. Honest to God, it's like a miracle.
Great.
Yeah.
So Nick, you did, unlike our other two panelists, have time to, make the decision to get the VAD. You weren't in dire straits here. So I wanted you to talk a little bit about your decision to say yes to the LVAD. Well,
see, the main thing, you got to have faith in God and in your family and the doctors and the nurses. That's the main thing. If you have faith, hold on. Okay, hold on a second.
How much is the case?
Just give me 1 second, okay?
No problem.
12.99.
That's for the
Yeah, I'm sorry, I'm at work. Anyway, you gotta have faith in your doctors. Ever since I met Dr. Colin, I felt good from inside, and he tried everything to get my heart the way it should be. And it's not about he gave up. Medicine didn't do any work with my heart. When he told me about it, I discussed it with my wife and my kids and my family. I got a big family. I mean, it wasn't easy. It's a big surgery, and God knows what's gonna happen. But again, you gotta have faith in God and your doctors and your family. And I mean, like what I said, you know, I mean, I said, okay, I'm gonna do it no matter what. Either I live or I die. You know, I will do it. And again, faith number one. I did it, and the day I woke up from the surgery, I told my doctors I want to walk. Yeah, I told them I want to walk. The nurse said no. I said check with the doctor because I wanna beat this thing. And I did walk for a little bit. I felt dizzy, then they put me back in bed. But like what I said, the first couple of months, it was hard. But once you start feeling better, you get your energy back. You can sleep at night. I wasn't able to sleep at night. Every time I go to the doctors, they admit to the hospital because I built fluid on my chest. I mean, I gained my weight back. When I went to the surgery, I was 152. Now I'm about 210, which is my regular weight. I lost almost 70 pounds.
Good for you.
I mean, you can say my body was shutting down.
Mm-hmm.
I mean, it's like, it's a miracle. No matter what, it is a miracle. And whoever created this LVADs, God bless them all. That's it.
You, yes.
Yes.
I mean, now I can do my normal thing. I can walk.
Yes.
I can play sports. I love
Yes.
to hunt and fish. The only thing is water. I miss swimming, but I mean, you know, it is what it is.
Can't have it all.
Yeah.
So just so you guys know, we have some team members from in the hospital, and they wrote in, it's so refreshing to hear of your successes. We see the hard part on the inpatient side and the readmissions of patients. Rarely do we get to see folks at this stage of recovery. So kudos to all of you, really.
Yeah.
You're doing so great and thriving. The next question we want to ask, which you guys are very far into your VAD journey. I would say you've had your devices for some time now. Obviously, I'm sure you're very comfortable with your device and maintaining it. But do you think that it took a long time to learn how to develop that independence with your VAD and how to manage it? And do you still rely on family members to help, or are all of you pretty independent now?
Yes, I'm more independent. Yes, I'm very independent. I don't, it's like once I'm this healthy and this feel good, I don't need the help anymore. I tell them, you know, I got this, you know, and I got this. It's been so long,
Right.
and I'm adapted to it. And I tell my LVADs, I'm 1 week on this. I think I done got so better that sometimes I don't even think they call and check on me no more. Yes, but no, they are they are awesome. They say, LaVisha, we know you're doing good. So it's just I'm more independent, and I like it that way. In the
Good.
beginning, it was hard, but
Yeah.
as the journey went on, it became very easy for me. Yes.
Good. How about you, Chris and Nick?
Chris, go ahead, man. He's not there. Okay. I mean, I am independent. I mean, my wife helped me a little bit with the drive line, you know, if she feels like it. But I mean, you know,
You're at work now, right? So you're like fully doing everything yourself.
I'm at work, and you know, like what I say, I'm back to my normal life. Sometimes, you know, I forgot to bring the batteries with me to work. So look at Angela, she's sometimes, not all the time, but you know, I mean, as far as the drive line and shower and all that, yeah, I mean, it become part of me. It's just, you know, I can't leave home without it, without the battery and the package. I mean, it's just become part of my life. Sometimes I think about it, okay, if I get a heart, how I'm gonna live without the LVAD, because it becomes part of my normal life, you know.
Yeah.
you know. And again, when you start feeling good, you know, when you start, you know, get your energy back, you know, you eat good. I mean, it makes a big difference. It makes a big difference.
Yes.
You know. Sometimes even when I you know, I look at some of my pictures before the LVADs, I mean, I said to myself, that's got to be somebody else. That's a different person. That's not me. You know, because of the weight I lost, and I want to do nothing. I just want to stay at home. You know, in and out the hospital. You know, it's just taking all these water pills. You know, it's totally different. It's different.
Visha, next question is the VAD team. What do we do? What things do we implement to make you feel confident about being able to handle yourself and be on your own with this device?
The LVAD team at the University of Michigan they are awesome. I mean, they are awesome. They pushed me. They pushed me. I remember Teresa used to tell me, I used to tell her, I used to walk to the store. And she said, Visha, how far is this store from you? And I said, well, it's maybe about across the street. She said, is that all you walking? I said, yes, because I was scared to leave the house. She said, you know what? I want you to walk further than that. So I started walking further than that, just with my children, just the LVAD team is awesome. They have helped me. You talk about a support system as well as a home support system. The University of Michigan was one of my big support systems. They guided me all the way through this. They knew I can do it. They knew it, and I am so grateful that they are all. I'm just grateful for Dr. Pagani, Dr. Dyke, Dr. Knotts, all of the LVADs. I'm talking about the whole crew. They are wonderful, and I am so grateful that I've turned out the way I am because of them. Yes.
Great. That's great.
Nick, what about you?
Angelina is my favorite, right? I'm looking at her right now. No, they all, I mean, they're all awesome. You know, when I met Dr. Jonathan Haft, I looked at him, I said, man, are you gonna do the surgery? I didn't believe he's that young. I was shocked. I mean, wow. You know, the whole crew, I mean, everybody, with doctors, nurses, the guy who cleaned the room. I mean, I was trying to find one complaint, honest to God. I couldn't find no complaints. I mean, the VAD team, everybody. I mean, I mean, when I go to the hospital right now to meet my LVAD, it's just like I'm going to see part of my family. You know, we talk about my health and we chit chat about families and vacations and stuff like that. You know, you still there? Oh, okay. Yeah, I mean, it's beautiful. It's a beautiful thing having the University of Michigan near us. It's a beautiful thing.
Yeah.
I know, Nick, you sort of briefly discussed this, but about how much more you're able to do now with a VAD than you could before. And you sort of gave some examples of, like, you know, you were walking and exercising, LaVisha, you too, but how do you think it's made the biggest impact in terms of you being able to do more?
Like what? What was the question again?
So, like, how do you think that the VAD made the biggest impact on you being able to do more? Like, what types of activities can you do now that you couldn't before the VAD?
I mean, everything. I mean, before the VAD, I couldn't walk for about 10, 15 feet. I mean, you know, and me personally, I've been in sport all my life. I played basketball. I can run. I can walk. I can do I used to do all kind of stuff. But when I start having the heart failure symptoms, I end up in the hospital. My ejection fraction was almost 10%. You know, and I suffer for almost 2 years before I end up going to University of Michigan Hospital. You know, they did all kind of tests on me. They find out I have sarcoidosis on my left side of the heart. And like what I said, Now I can walk 2 football fields easy. I
Good.
mean, yeah. I'm the only thing, I don't abuse myself a lot as far as running and playing basketball. But it's big different. It's big different. I'm not tired anymore. I'm active. As a matter of fact, my wife always tell me, "You too hyper." November we went up north. We went deer hunting. I was very proud of myself. All my friends and family, they said, "Man, how you do that kind of stuff? And you have core of a heart."
Yeah.
I said, "It's a blessing, and it's the LVAD, I guess."
Yeah.
How about you, Chris? I'm glad you're back on.
Yeah, somehow I got lost. I don't know how, but what was the question?
You're pretty active. Like, what can you do now that you couldn't do before the
Well,
LVAD?
That's sort of difficult for me because I didn't know what my
Couldn't
limits
do.
were before,
Yeah, right.
But right now, I would say that I don't really have any limits now that I don't want if I apply myself. I mean, physically, I am able to do everything I enjoy with the exception of swim.
Mm-hmm.
And everything else, I tend to garden. I mean, I just do everything that I want to do.
Good.
It's all a process of getting used to stuff and getting used to the equipment. You're wearing an equipment now, so you got to be a little more careful. But I can't say that there's been many limits that I've had.
Okay, great. LaVisha, it sounded like you were pretty active too, right?
Yeah, yes, very active. Yes, very active. In the beginning, no, I couldn't walk to the bathroom. I'll be, "Help me, y'all, help me. I can't breathe." Just the things and, puking a lot. I did a lot of puking and I was just, and that was like that for maybe about 3 months before I could even get to the University of Michigan. And I had lost a lot of weight, and I knew something was not right, but I just didn't know the severity of it. But now I'm unlimited. I can walk miles and miles and miles and just, not get tired. I can walk, I can go out there and wash my car, spray it off, just sweep and, do the things I couldn't do. Yes, I can do them now. Yes, no
Great.
limit.
Amazing.
All right, guys, we have just about a minute left. I'm wondering if any of you guys want to give anyone considering an LVAD any advice.
Go for it. Look at us. Look at us.
Yes.
Go for it. Look at us.
Yes.
We're here. And it's the best thing. When I had this 13 years ago, I had children. Babies. They all graduated from school. With this LVAD, I was able to see them all graduate but one from school. Get it. You can do it.
It really helps for a lot of our young mothers, LaVisha, who struggle with that decision.
Yes.
For me, like what I said, I advise anybody who have heart failure symptoms, LVAD is like it will save a lot of lives. It saved a lot of lives. It saved my life. If you have to do it, just do it. Don't hesitate, no matter what. And like what I said, again and again and again, you got to have trust in your hospital, your doctors, your nurses. That's number one. If you have trust in them, you're going to be all right. And again, your mind control your body. If you think positive, no matter what, you will survive. You will survive.
Yes.
Keep your energy, think positive, travel, do the things you like to do. Life is too short.
Great. Chris, anything to add?
Amen to all of this. It is wonderful to be alive. It's wonderful to enjoy life. We had our problems before, but now things, the LVAD isn't an obstacle. It just allows you to enjoy life. I mean, that's, and yeah, there's going to be challenges, but with everything, and from where my standpoint is, all three of us, I think we would, life living is much better than life dying, so I mean, this has allowed us to enjoy life, to enjoy our family, our friends, and to do what we want to do and the way that we should do it.
That's excellent. Thanks so much, all three of you, again, for your time. We really, really appreciate it. Thanks so much.
Yes, thank you for having me.
You're welcome.
Absolutely.
And just from our co-host Erica, she wrote in, thank you for sharing. I have so much respect for all of you. Thank you.
Thank you. Thank you.
Thank you.